Hey, Dr. Derek Nielsen here. I'm the owner of Kaizen Physical Therapy, where we help people who are age 40 years and older who've been dealing with pain for 6 months or longer. We help them get back to being active and mobile without pain meds, injections, and surgery. And today I want to talk to you about the most important piece of advice that I could offer to anybody. I had a recent patient ask me, what's the number one thing that you could offer to anybody, even if they couldn't come and see you? And it would be this. But first, before I forget, I did just make a book specifically for you if you're dealing with some discomfort and you're actively looking for a solution. Go ahead and pick it up you can download it for free. You'll find it at thepainreliefbook.com, thepainreliefbook.com. Go ahead and download that for free. But the most important thing that I could offer is really it's just a single question is when did the discomfort start? When did the pain start? Did it start when you bent over and you went to pick something up, you heard something pop? Did it start, you woke up the next morning, your shoulder was all of a sudden hurting and it's continued hurting? Did it start when you were running? Or was there something that you can point to, some specific activity or some specific event or some specific time when the pain started? So what I mean by that is the far majority of people that I see come into the clinic, pain has been going on for some time and there's no specific event that they can point to where, yes, this is the exact moment when the discomfort or when the pain started. And why that's important is because a lot of times people they'll go into the medical system and they've been dealing with pain for a while and they're finally ready to look for a solution. And they'll go to their physician and the physician will take an x-ray or an MRI. Okay. And a lot of times what they find on an x-ray or an MRI were there before the pain ever started. So why this matters so much is if the x-ray or if you can't point to a specific time when the pain started, then what they find on an x-ray and MRI was likely there in the first place. Conversely, if you bent over and you heard a pop or there was some sort of traumatic incident, when you can point to when the pain started, then what they find on an x-ray and MRI likely means or could have something to do with the cause of the pain. So the reason why I say this is the best piece of advice that I can offer to you is because a lot of times people will go in and get an x-ray and MRI after pain has been going on, and they find something on the image which actually isn't the cause of pain, and then they're told to, maybe possibly pain meds or an injection, a steroid injection, which has some pretty nasty side effects, or hopefully they're told to go to some PT, but they're offered solutions, maybe possibly even surgery. They're offered some solutions and they don't get the outcome that they want. And that's because there is what we call a false positive, is where the image that you take, the x-ray and MRI on that image, the finding wasn't actually the cause of pain in the first place. It was there before the pain ever started. You just didn't know it was there because you didn't have an image prior to the pain coming on. And so they're offered a solution or an intervention that's not what they need, and then it doesn't give them the outcome that they want. And so that's the best piece of advice that I could give to anybody is, when did your pain start? If there's a particular incident or a particular time or a particular activity of when that pain started, then what we find on the image can possibly mean something. But if pain started over time and it just gradually came on and there's nothing you can point to, then usually the x-ray or the MRI finding aren't going to mean near as much for the reason or the cause of the pain. Again, if you're looking for a solution, actively looking for one, go ahead and download my free book. You can find it at thepainreliefbook.com, and it's free for download. This stuff has taken me over a decade to learn, $300,000, and I'm giving it to you for free. So go ahead and download it, thepainreliefbook.com. And if you benefited from this, I would love it if you'd share it out to other people that you think need to hear this message as well. All right, thanks so much.